before their 18th birthday. An unprecedented fragility and humanitarian need really compound some of the worst impacts of child marriage on adolescent girls in humanitarian contexts, including on their health, their safety, their education, their economic opportunities, and their agency. So I'm very excited to welcome our guests today. Our discussion will really focus on not only the needs and rights of girls impacted by child marriage in humanitarian contexts, but also the rich activism of place-based feminist organizations who are building a movement in East Africa to prevent child marriage and support married girls. So I welcome you all here today. Just one or two notes of housekeeping. We really want to invite audience engagement. So there's a Q&A function at the bottom of your Zoom page. Please feel free, as we are talking, to include your questions there. We'll have a segment towards the end where we can actually raise some of those questions and have a discussion. But first, I really want to turn the floor over to our colleague and such an inspiring activist and leader, Dr. Nardzai Gumbonzwanda. Nardzai is the founder and chief executive of the Rozaria Memorial Trust, which is an organization based in Zimbabwe focused on supporting girls and women living in rural communities to promote education, health, and entrepreneurship. For 30 years, she's been active in the women's rights movement, working on issues of women's and children's human rights, including violence against women, property rights, sexual and reproductive health, and HIV and AIDS. She has served as the Goodwill Ambassador for the African Union Campaign to End Child Marriage since May 2014, and has held several leadership roles with the World YWCA, Action Aid International, Civicus, Save the Children, and so many others. So welcome, Nardzai. I am so pleased to have you here and would love for you to set the stage for us. What was this research that we did together on child marriage, and what is the advocacy that you and others in the area focused on when it came to child marriage?
Thank you so much. Thank you so much, Gantry. It's International Women's Day. So we not only do we celebrate, we continue to raise the issues over and over and over again for us to claim our rights, to seek protection of our rights, to demand that women of the world in stable countries, in fragile countries, enjoy their human rights and that they are protected. It's our day for empowerment. So thank you so much and congratulations to everybody who is taking action and speaking out on International Women's Day, and of course within the context of CSW 67. Let me recognize the colleagues and appreciate the government of Denmark for the support. Andreas, great to have you with us, and amazing solidarity and support. We want to appreciate the great leadership of the government of Denmark on these issues. Appreciate our collaboration as Rozaria Memorial Trust with the Women's Refugee Commission. A big shout out to the colleagues we worked with over the last 2 years. Jana, if she's in the room, and other colleagues, and from the King's College, Aisha and team. So we came together in this consortium of partners, which included the Women's Refugee Commission, King's College, and us, Rozaria Memorial Trust. You can already see a combination of an international women's rights organization, which is concerned around issues of displacement rights, and an academic institution into research, and us as Rozaria Memorial Trust, community rooted, and at the time also in the context of my mandate as the African Union Goodwill Ambassador. Just the nature of the consortium was saying we can no longer work in silos. We need to combine government efforts like the government of Denmark, international NGOs and research institutions, academia with practical lived experience, but do some concrete work in communities, in countries. So this research was focused in East Africa and focusing and addressing issues of child marriage in humanitarian settings, And definitely Dr. Aisha is in the room, and later she can add further information. What for us was very evident and in our methodology and approach was that we need to go beyond the visible and loud voices and go to the invisible and significant narratives in communities. A feminist approach that allows us, that enables us to go into the crevices of our community. So in terms of the work, the way the work was done and the mobilization and engagement was really to look at those community groups and partner with them. And I'm very excited to also see Farida here, who share her own experience. So the methodology was both interactive, academic analysis on what is published, but also looking at the concrete experiences out of each were the findings and out of which we developed a roadmap. I just want to emphasize a couple of things that in terms of the research today, we are focusing essentially on the issues around married girls. That's where the main focus is. But the research was more than married girls. And for us, it was also very important, and for this discussion today, that we have tons of methodologies and approaches around prevention. But the prevention work has to have a good interface and linkage with the protection of those who are already living in the abuse, have experienced the abuse, because what we call child marriage, and it's and my work as AU Goodwill Ambassador and from the research, we must shift the language. It's not a marriage. By calling it a marriage, we are perpetuating acceptability of a negative, of a crime, of a negative moral and cultural norm. We are perpetuating acceptability socially. So first is just the issue of language and unacceptability of language that internalizes abuse and exploitation of women and girls. Secondly, is address the issues that cause the marriage, because even when a girl is married today in a camp, she may move out from that relationship tomorrow and may get married again. So the support to married girls is not just as if the marriage is singular, it's a singular narrative. It's not, it's complex issues. But then we have the whole range of issues around education, psychosocial support, economic empowerment, and exclusion, including in our feminist women's movements. Because when a girl is married, at times she's no longer treated as a child. So she cannot fit in the children's clubs or youth clubs. But she's also not treated as a woman, as a mother. She may not be able to go to the old mothers groups like my own groups. And so at times we find some of these girls without the social support systems and networks that would nourish them and that would assist them. And lastly is the issue of justice. And what is that justice in a fragile environment of a humanitarian context? We have further discussion on this, but this is just the ways, some of the key issues that emerged. And in conclusion was the roadmap. The roadmap was co-created together with many partners. Some of them are in the room, and we had a meeting 2 weeks ago. The co-creation of the roadmap identified the key objectives, the vision that we'll be looking at, but also how we move forward, because I am tired as an African woman. And please let me just repeat, I'm so tired of being over-researched about our body, our lives, without accompanying support following the research. So what I loved about this work with the Women's Refugee Commission and King's College was that it didn't stop at publishing the research findings. It actually co-created together with the communities the roadmap for implementation, because we are accountable to the stories and experiences that women and girls tell in their communities. And part of our collective responsibility is to resource those community interventions and be accountable to their vulnerability of telling us their stories, co-creating with us their solutions, because that is where justice starts and that is where human rights begin to be enjoyed. Thank you so much, and back to you, moderator.
Thank you so much. For those of you in the audience who haven't seen the roadmap, we'll publish the link in the chat. But it was an incredibly inspiring process to bring together these community-based organizations, these feminist organizations, to really look at, as you called it, this invisible group of girls who lack social support systems yet face very critical and unique issues in their day-to-day lives. And so very much appreciate your point about not just researching, but also funding, supporting, and promoting forward action. So thank you for that. And we do want to hear more about that work. But let's turn to our other colleagues as well, and then we can have a bit of a dialogue. Want to introduce first our colleague Farida. Farida Alpha is a refugee youth leader and activist, originally from the Democratic Republic of Congo. After her husband was killed, unfortunately, Farida fled DRC for Uganda, where she lived for a time in the Kiaka settlement with her son and brother. There, she took off. She started the Vision Refugee Group, which is a group to engage youth in music and dance to promote community engagement, girls' education, and sexual and reproductive health, and to combat gender-based violence and child marriage. She also went on to found One Touch, which is a solar-powered music studio, as a livelihood initiative where she and her brother produced songs about community issues that they were working on. And Farida also then built and ran a vocational training program for girls at risk of marriage and child mothers. Farida recently settled in Sweden and is a member of the UN Refugee Agency's Global Youth Advisory Council and Search for Common Ground's Global Youth Leadership Council. So welcome, Farida. Next, we also have Andreas Kjaby, who is the Chief Advisor on Humanitarian Affairs at the Danish Ministry of Foreign Affairs. He has a particular focus on protecting people from harm and violations during times of crisis. Prior to working with the Ministry of Foreign Affairs, he worked for 15 years with civil society and the UN. He's been posted in many places around the world, including Nepal, Kenya, South Sudan, and Myanmar. And he's now based in Copenhagen. So welcome, thank you for joining us. Let's kick it off with a question for Farida. Farida, what have you observed in your work, in your experiences, in your day-to-day life? What are the impacts of child marriage on girls? And how have you worked in your community to prevent child marriage, but also to really support those who have experienced marriage or are currently married right now?
Thank you so much, Gaitari. I'm Anaru Minai from the Global Youth Advisory Council, but currently I'm with the Global Refugee Youth Network, which is green. I wanted to correct that, but I'm happy to be here. Child marriage, for me as Farida, means a life sentence. When we are forced to get married, it is an imprisonment. And child brides means child mothers in a simple words. So raising a child is a challenging experience, and it is even more challenging for child mothers. From my own experience as a child bride, I can share that child mothers face financial struggles, lack of support, lack of access to resources and opportunities, emotional battles, loss of their identities, and more. And they have also to cope with bullying within their families and also in the community, mental health crisis, and high stakes difficulties in supporting early childhood learning and childcare. Girls who are raising children, they are just children themselves. And many of them are all alone as the result of divorce, abandonment, widowhood, and domestic violence. Many girls who are raising children, they're raising those children from rape. They feel guilty and self-doubt, self-hate. They feel inadequate. Unlike they are not enough, that is they are unworthy, and all of this can be quite stressful, both for the parent and the child. Girls who are child brides are scared for their lives, and they need someone to talk to, someone to trust, someone in the community watching and caring and listening. My own journey has permitted me to learn from them and enabled me to be fully present and support them in expressing all their emotions. I want them to feel the truth of who they are. But by understanding and addressing these pain points, they can take steps to reduce stress and improve their overall well-being personally. In Chakatu Refugee Settlement, where I lived, I sat and listened to young people. I saw the most vulnerable girls and young women in the refugee community are deep in poverty. I realized that I should start doing this vocational training to help them. I learned skills like making soap and reusable menstrual pads, and I taught them what I knew. Eventually, in 2017, that is how I started that non-profit community organization, the Vision Group, and which provides girls with skills in tailoring, hairdressing, and soap making. We teach adult literacy because also the language barrier affecting these child mothers. And also, we teach them how to take care of themselves. We provide education about menstrual hygiene, sexual and reproductive health, rights, services, and self-care, so they can know about their bodies and prevent unwanted pregnancies. Most of all, we provide a safe space where they can feel at home and can talk about their experiences. We provide love. The most effective advocates against child marriage are the people who have lived through the same experience. We have that passion to make this end. And also we are living in the community. We know the community and we are there all the time. And that's what I can say. Thank you, Madam Moderator, back to you.
Thank you so much, Rita. That is incredibly important to really help heal, and what you said about, you know, providing love and giving them a sense of self really resonates with me, because when you are invisible, as I mentioned before, you do feel that sense of, you know, guilt, worthlessness, etc., and the impact on mental health, impact on your children's mental health, etc., is quite strong. So very much appreciate your efforts, and thank you for that. I wondered, Narzai, in your work, what do you see as really critical for policymakers and others who are active and responding to humanitarian crises in particular, to really understand about the needs and the rights of girls who are married or girls who have experienced marriage?
A couple of things, both from my everyday work in Rozaria Memorial Trust, and we've just been responding before to Cyclone Idai and now to Cyclone Freddy, which is threatening us, but also the years of work in East Africa, where I was based for almost 10 years, and as a Goodwill Ambassador. What is critical is we have good baskets of policies. I mean, even on the humanitarian, we had the Istanbul summit, we have baskets and baskets of commitments. What is lacking at the policy level is accountability and implementation.
If I could follow up on that, what does accountability and implementation look like?
Led, community-driven interventions, because it is the women who are on the front line and will remain on the front line. So we may talk about displacement of everything else, but the people always want to come back and rebuild their communities. So I think that is the first, that we are not just talking about the lives of individual girls, we are talking about the fabric of a society which is being fractured. Just listening to Farida there and talking about the bundle of pain. And if we can turn all that bundle of pain to bundle of opportunities and skills and avoid that. The second most critical is to shift the approach we do humanitarian response. And I really like the feminist humanitarian principles that has been developed by the feminist women's movement, and which is linked to the very much grounded in the research that we did. What came through very closely is we need the big humanitarian organizations when you are developing the models of implementation to be co-owned models, so that it's not a hit and run after a humanitarian situation, but it's actually a response mechanism that is integrated. And the last is to be creative. A humanitarian context creates extra vulnerability on an already vulnerable group of girls. It's an extra layer. We have not even started to talk about girls with disability in a humanitarian setting or with mental health. We have not even started to peel all the different layers. So that in itself means there has to be targeting. There has to be targeted resources, targeted interventions, even having an indicator. I'm listening to today's International Women's Day. There's good rhetoric, very good generalized rhetoric, but I miss the nuancing. I miss the numbers. I miss the names of the villages. Let's get closer to the people we are talking about, and not in a very generalized. If you're talking about an experience in South Sudan, let's say this was in Wow, this was in Abyei. If we are talking about Uganda, was this in Lira? Was this, where was this happening? If we are talking about Kenya, let's name, because the more we name, the more we connect, the more we relate, the more we give visibility. So I think the last is supporting from a research point of view. It was amazing to work with King's College, but also saying, can there be greater collabs with academic institutions in the Global South as well? So that we also continue to infuse the academia with the experiences that, that we have. So from an NGO point of view, it was great for us to collaborate as Rozaria Memorial Trust. I think the last is to governments. And it's good we have the government of Denmark in the house, and which is also to my governments, Zimbabwean government, my African Union. Women in communities are not in the decision-making of the humanitarian space. When we took at the humanitarian coordination mechanisms, even in my own country, at the local level, I'm happy that Rozaria Memorial Trust is part of the Civil Protection Unit at the local level. But when it comes to where critical decisions are made, we rarely find sufficient representation of women, including women as experts, and not just as vulnerable women, as experts in the decision-making structures of the humanitarian response. So the donor coordination meetings once every 2 months invite the women's organizations to a discussion. The donors, UN coordination mechanisms, OCHA, talk to us, involve us, so that we are not just knocking on the doors, begging, because we are not begging. We're simply saying we are citizens with a life, and we have something to offer. So for instance, as Rozaria Memorial Trust, we have a center, a whole center that has been at the part of the response. So communities are not coming empty-handed. They are coming with something, but that contribution of communities is unrecognized, unaccounted for. And we want it to be in the matrix of the humanitarian response. And if our governments can do that recognition, the inclusion, the recognition, the resourcing, and the accountability, I think it would be, we would move the needle very powerfully. And ultimately, it's a crime. Child marriage is a crime. So we should not justify it by religion, by culture, by saying, well, girls are getting married so that they get protected by the warlords. No, it's a crime. There should not be any justification for rape. We cannot use any rationalization to justify rape. Thank you.
Incredible, thank you. It was by design that we have Andreas with us and the government of Denmark, because as a donor, as a global policymaker, as an influence in humanitarian action, would really love to hear from you, Andreas. How do you shape your priorities and your policies around some of the things that Naizai and Farida have talked about when it comes to supporting married girls, their mental health, their economic opportunities, their visibility, their engagement in designing humanitarian responses, et cetera?
Thank you so much, and it was really such a it's so clear that, exactly as Farida and Dr. Narazai said, that big government donorship does not lend itself very much to love, to context, to that sort of human care that the panelists were speaking about, which is needed at sort of the level of where programming becomes reality. And I think that's really the challenge, that many of the systems that we have built have become so big that getting that context is difficult, that having that people-centered approach is difficult, because at the same time you want to move at scale, you want to move at speed, and there's just many tensions in these relationships that are difficult to resolve, right? But we just got to find ways to deliver humanitarian assistance and humanitarian or crisis programming in a way that is people-centered and that can have that context sensitivity and allow us to get closer to the people we want to assist. I think for the Danish government, besides having sort of a thematic focus on education and making sure that education is also accessible for married girls, or focusing on sexual and reproductive health and rights, I think there's a lot of move to focus on the sort of mental health and psychosocial well-being of married girls and their communities. And I think some of those thematic areas are, of course, important ways to leverage. But I think also what was mentioned was the importance of working with women-led organizations or local organizations and really find ways to devolve power and resources as close to them as possible. And I think here the feminist approach is very interesting because it allows for that extra nuance, so that it's not just about localization or local leadership, but a much more nuanced understanding of what's part of that local ecosystem and how can we devolve power and resources to the right spaces where there are genuine efforts to help girls and women.
Thanks, Anders. I really want to pick up on that last point, the idea of feminist approaches allowing that kind of contextualization that Farida and Naizai spoke about. But there are also other solutions, including proactively including women's rights organizations, community-based organizations, women leaders themselves in some of the design and implementation of humanitarian programs. Is that something that, in this process of building at scale or working swiftly in a humanitarian context, how do you see that being embedded in some of the programs or in some of the policies that your government or partner governments promote?
Well, I think first and foremost, it's about putting the commitment and that risk willing it out there and say, it is local communities that are responding first. It is not the big international organizations. So it's some of these things are also false constructs that you can't operate at speed because then it has to be international. So I think it's about recognizing that there's a lot of speed and there's a lot of scale happening at local levels. So first of all, to sort of bust that myth that it has to be international if you want to be at scale and if you want to be at speed. I think another thing is to just have very clear expectations to what, to our sort of international partners, that we want them to devolve power and resources to local levels, that we are very carefully looking at the localization commitments of UNFPA, of our UN partners and our international INGO partners, to transfer sort of the quality of funding that we give them, that they also bring that to their local partners. So when we give multi-year flexible funding, we expect that to follow through all the way out to sort of the villages that we are working in.
Thanks, Andreas. And I do want to note, the government of Denmark has been at the forefront of this process of localization, or the commitments around localization. Your leadership of the call to action on gender-based violence and emergencies, your work on the Grand Bargain working group on localization, all really kind of galvanized the donor community and the government community around some of these principles. So it's fantastic to hear that, you know, the idea is to build that into your systems, your processes, your relationships with your grantees. And I would love to hear more from Rozaria and Farida about some of those partnerships and how we can build those into more equal partnerships between INGOs and community-based organizations. So maybe we can turn to that a little bit. Farida, what do you think that donors and international policymakers really need to prioritize when it comes to addressing the needs of girls?
Yeah, I think donors and international policymakers should prioritize increasing support for adolescent girls and also their families in development and humanitarian contexts. And this means like the greater investments in education still, and economic assistance, also prevention of gender-based violence, and also youth-friendly sexual and reproductive health and rights programs. And it is vital that important of work with girls with lived experience and community-led organizations. This is the long-term intervention to address harmful gender norms and promote refugee girls' voices and their choices. Investments in basic services are needed, including the participation of community-based organizations that are working on gender equality and child's rights, to identify and also respond to the needs of refugee girls in their communities, and also preventing child marriage and supporting its survivors must be integrated within the child protection and GBV areas of responsibility, and within education, healthy sectors, and livelihood responses, to ensure a comprehensive and multi-sector sectoral response to all refugee girls. And also, when we come to the need to listen to refugee girls who are survivors of child marriage, girls need to be listened to. They need to share their stories and feel empowered. Refugee girls with lived experiences should be engaged as ambassadors to stop child marriage, support survivors, and change their communities who have gone through forced child marriages, and not only the beneficiaries, but also as partners, and make sure they have trainings, they have the skills to engage and be empowered. And another thing which I want to add is the involvement in decisions. Children, especially girls, refugee girls, I speak this from my heart. Refugee girls, those forced into child marriage, need to be involved in decisions that impact their lives, and to design programs together with funding organizations. And this is so crucial to good programming, yet seems to be very hard for many organizations to do that. And to these girls, the child brides and child mothers, they are invisible. Many child mothers do not have any documentation of their own. Their identities are covered up and they are lost in the community. So they are not in schools. They can't join any activities with their age mates, but also without documentation, they cannot access services. And often they will raise their age in order to get documentation themselves. But them, they are not identified as child mothers and afforded the support they need to get. So you find that these organizations, the local organization, refugee youth organization, or the girl-led organizations, they don't have a bank account at the local level. So I think when they become partners, it needs to find that the easier way, the easy solutions to partner with them at the local level. And also, what I can say, the big gap is that many donors are set up to work with big organizations, not small CBOs. And they have process and criteria that make it very difficult for local community groups and to even apply for funding. And many, like many survivors of child marriages, had to drop out of school and did not have an opportunities to learn English or project management. But they have a lot of very important knowledge and skills, but they may not know how to design and present a project. Donors need to identify these gaps and connect with the refugees themselves at the local level, or the organization to connect with the refugees themselves to plan together. Thank you.
Thanks, Farida. I think that message is so critically important, that the partnerships have to happen, the partnerships with community-based organizations, with refugee-led organizations and youth-led groups. Those need to be more direct between donors and those groups. And I'm wondering if you have any good examples of what that's looked like in a positive way. How have girls been engaged in some of the decision making and some of the implementation of humanitarian assistance? That's a question for Farida, but Narza, if you have any thoughts there too, I'd love to hear.
Yeah, I can. Okay. Can I add? Oh, it's for doctor. I don't know. Let me say, I think like an example, I want to give an example. We started the Global Refugee Youth Network as the Green It's for All Refugees in the leadership, specifically to bridge these gaps between the local groups and the resources that they need to be effective in their work. So Green is a refugee youth network that connects and advocates globally and supports work at the local level. And also the Global Refugee Youth Network reaches out to young people who are refugees in the remote areas, has created a simple call for proposal targeted at local refugee youth-led groups. And even those are informal and don't even have a bank account, and helps these groups to build their capacity and also channel funds to them to run small projects from their own. And also we are supporting the underserved refugees, young people who are making difference in their communities, especially those girl-led organizations. So I think donors should work with different networks, like, for example, like the Global Refugee Youth Networks or other networks that can bridge that gaps and help to make the connection to survivors who are leading work in their communities. I think that is an example I can give. So, and also those who want to learn more about the green work, they can access our platforms. They see all the young people we have supported, we have shared with fund, and also the good work and good practices they are doing in their communities to change their communities. Thank you so much.
Thank you. I can jump in and give an example. I think for me as AU Goodwill Ambassador and also within Rozaria Memorial Trust, I've seen some exciting work on the African continent that we need to scale up. So first was through the Gender is My Agenda campaign, the GMAC network, was to provide a systematic participation of young women and girls, including those who experience child marriage, to participate in those meetings to influence both the mainstream women's rights movement and also to have their voice within the African Union mechanisms. And it's almost a given now that the African Union has institutionalized the periodic African Girls Summit, that at every Girls Summit hosted by the African Union, there has to be self-representation of the young women or the girls who experience child marriage. The next summit is going to be in Mauritania this year. The last one was in Niger. So I think out of this research and the work in East Africa, we have an opportunity to scale and to institutionalize those examples. We've also seen a solid systematic work happening within the SADC, the Southern African Development Community, where the work around the model law on ending child marriage has now evolved into addressing issues of gender-based violence. There's now a model law on gender-based violence. And last December was an official space for a week where the parliamentarians were listening to civil society and to girls who experience child marriage directly. So I think there are models which are emerging of direct influencing as part of the official monitoring mechanisms, which go beyond just a sharing of information, but also to say, where is this country, how is the performance? And I think these are some of the things that can be scaled up. But what I also see is critical, to build on what Farida had said, is out of this research was a roadmap, and we can and request that the roadmap be shared, and request the government of Denmark, Andreas and your networks and colleagues and other member states to receive, because for us, we are saying this is the analysis, this is the roadmap, receive it, share it, because we can recraft, but it's already expressed. I think the other is working with women's funds is going to remain very important. I think Farida has already mentioned flexibility. Yes, we have the big funds which respond to humanitarian situations like the SAFE. We have the big funds like the Violence Against Women Trust Fund. But the communities we work with and the feminist approaches we are looking, it's those complicated log frames which assume you have to apply online, which assume you have internet, you have a computer. When we are talking about people in communities who may not have the basic technological infrastructure, we need creative models of reaching out and resourcing without relying on the dominant assumptions of the existing tools, which would exclude the same groups that we want to include, either in the decision-making or in the resourcing. So I think a flexibility of modalities of engagement is very important. I leave no one behind. I don't like that term because it's too much rhetoric. We say leave no one behind, but those who control power are actually the ones leaving everybody behind, because those who are not in control of power, of decision-making, who don't have the big van, they can't leave anyone behind anywhere. So it's actually, the question should be, why are we leaving others behind? I think a feminist conversation is why and what do we need to do differently to make sure that we don't leave the girls who are at risk of marriage, we don't leave the girls who experience child marriage behind. What do we need to do differently? I think the question should not just be a general leave no one behind, asking somebody to do it, but we should ask, I live in my village, 100 kilometers out of Harare. And I realize that the greatest joy is waking up every day in the experience. So we want to request that the big money for monitoring visits to the field, reduce those big vans for monitoring to the fields, give the money to the local group for them to run a shelter for survivors of child marriage and gender-based violence. Reduce the number of monitoring visits because you reduce the number of fuel costs and give that money to a shelter, because we can use the available resources by reprogramming it and deprioritizing certain things and trusting that communities would have the same accountability that is expected. I think giving resources to community should not compromise the issue of accountability. Communities have to be accountable of the last penny, but they need to be trusted. I think there's not enough trust of local community groups currently within the sector. And that therefore limits the quality of investments that goes directly to communities. Thank you, and back to you, Jantri.
Thank you. That actually leads us really nicely into the, I think, last question for Andreas, which is, we have these global networks like the call to action on gender-based violence. And for those who are not familiar with that, it's a body that brings together states and governments and donors, as well as INGOs, international organizations, and national and local place-based NGOs. To really think through solutions to addressing GBV and emergencies. Andreas, the government of Denmark led that network for 2 years and recently handed over leadership to the government of Germany. But in your view, what can networks like that are kind of bringing together the various actors but operating at a global level, how can those networks be and partnerships really be mobilized to get to some of these nuanced approaches to addressing child marriage and supporting married girls in humanitarian emergencies?
Well, I like to think that these initiatives, they do build momentum both between organizations, but maybe also within organizations. And I think that's part of the critical bit here, right? How do you uplift these things beyond sort of the usual suspects of people who care greatly about these issues, but how do you really lift them across these sectors, which I think is also part of a lot of the research, right? How do we create a vision and some objectives that goes beyond just, the gender-based violence actors or the child protection actors, but because frankly speaking, I think we've created so many silos that it has disunified us. And that really works against our ambitions of a better world. So we need to find ways to really come across here. And these platforms of call to action could be really good for that. We've met new colleagues in Nigeria, wonderful colleagues such as yourself. So it does create these spaces, but as the Dr. Naratzai said, it could also very easily become these baskets of commitments that goes unfulfilled or that are just sort of regurgitated commitments over and over again made in different spaces. So I think it is really about how do we ensure that we're accountable for these commitments, and how do we also make sure that we have time for implementation. Sometimes we're also so busy sitting in spaces where we can make new commitments and new policies, etc. I think just like in many other issues, such as, for example, the climate, the time is really for implementation. It's not for new commitments. We know what's being done wrong, and we really just need to push on the implementation side and give ourselves the space and the energy to do just that.
Thank you. I don't want to cut our discussion short, but we are running short on time, and I do want to get to some of the audience questions and answers. The first question, which, apologies, we should have started with this. The first question is, could somebody define child marriage for those of us who aren't educated on the basics? Naratzai, is that something that you can just briefly define for us?
Yes, I think quickly, child marriage, legally, international law is saying a person under 18 cannot marry a boy or a girl. That's in the Convention on the Rights of the Child, but also for us within the African Charter on the Rights and Welfare of the Child. So that's the standard. But we know that countries at times have clawback clauses where they then justify on the basis of religion or culture. But a child is a person under 18, and that person should not marry.
Thank you. Then the next question is for Andreas. The question is, how will the government of Denmark remain accountable for the work co-created and implementation of the roadmap?
Well, I think for what's interesting about the call to action construction is that it does it does have each member come up with some commitments where there is an indicator front one, there is a reporting mechanism. So there is something there to sort of latch onto. And of course, you can always ask whether it's sufficiently concrete for sort of true accountability. And I guess the proof will be in the pudding. But I think it does have, a quite, and it's publicly accessible for everyone to go and see on the websites. People can see what have different organizations signed up to. There's an annual reporting function. But again, I think my question goes back to, do we then end up spending so much time delivering on the Excel sheets and the reports and the documentation, all of that? And how do we really strike that right balance of getting all those pieces right, but then also, energizing sort of commitments on the ground?
Yeah. And the roadmap that as I mentioned earlier is the roadmap that was developed by the feminist place-based organizations in East Africa. And that's something that certainly the call to action can promote and make more visible to other partners and donors. But this question of accountability is incredibly important. And what I heard Narzan mention and Farida mention is that it's great that we have this roadmap, and now we need to really resource the action that comes from it. So that is another measure of accountability, I would say. The next question is, how many parents, guardians, and carers have been held accountable or prosecuted for their role that they play in forced marriages? This, I think, is a really interesting question. Country by country, it varies. But wondering, Narzai or Farida, if you'd like to weigh in on what that looks like in the places that you've been working.
Can you repeat the question, please?
This is so important, because when we talked of the 12 million girls getting married each year, we're saying around each child getting married are their guardians. Is the person marrying? Is the person facilitating the marriage? So when we are actually talking about accountability of adults, the person marrying, the people condoning the marriage, those facilitating the marriage, and the public sector institutions who may not be providing a service to prevent or to protect. So child marriage is a total failure of our collective responsibility to protect the rights of children, and therefore resulting in the trauma that you have had. I have heard so many talk about wanting to commit suicide and or range. So yes, we now have laws in a number of countries, including in my country and also in Mozambique and others, which also bring accountability to the parents. So parents under the marriage law, whoever is responsible for facilitating a child marriage, in addition to the person marrying, is liable, because we need to also address that aspect where child marriage is facilitated by adults and guardians and caregivers. So great question, but definitely a collective responsibility.
Thank you. Farida, did you want to add on to that?
I think Dr. Nyalazaya has mentioned it all, because they asked you who is in charge, if the caregiver. For me, the one who gave me out was a caregiver, was not my parent. But also this happens day and day in the refugee community, whereby also the parents, they exchange their children, they give out to their children. The caregiver, they give out to their children. And also you find also the local community, the local councils, if a parent is a refugee, the local council give out their children. So I think this is all sides. And also you find someone from the, a church, a mosque, they're giving out their children, and they underage, a 12-year-old girl, or 13 to 16 to 17, who are still young. So I think it's all sides. A caregiver can give out those children, the parents, and also the community, because in a refugee community, there is girls who are unaccompanied. They don't have any parent. So when they give them out, or they are in the community just moving around, someone can sort her out, and they take her by force, and no one seems to be caring. So I think also the neighbors, I think this is about everyone in the community, because child marriage is beyond my expectation as me as a survivor. Yeah.
That's really important. And your comments really remind us that it's so important to have survivor voices involved in developing legal responses to child marriage, right? It is about looking at the gaps, looking at how even legal implementation of laws against child marriage need to have a victim or survivor-centered approach to them in order to involve survivors and really meet their social and psychosocial needs, in addition to providing that justice and accountability. Last question, I think, because we're running out of time. Farida, thank you for the great work you're doing in Hyakatu refugee settlement, especially with girls. You talked about training skills, but what is next? After training, how have you engaged, what is next after training? And how have you engaged boys in the activities to stop child marriage in the refugee community?
Thank you so much. To that question, I'm going just to use a few minutes. With these girls, what next after the training? With the vision group, we hope we connected 100 girls outside the settlement with the right documentation from the Office of the Prime Minister to the available jobs. Because what I did is that when I go sometimes in the meetings, what I do to advocate for the refugee girls, child mothers who have skills, that anyone who have a job can give them a job, not to be in the community without supporting their children and also supporting themselves, because I need as Farida, them to change, to be someone else, not to feel guilty about what happened to them and it was not their choice. So we connected 100 girls to different salons in Kampala, the capital city of Uganda, to different people who have jobs, and also those in tailoring skills. We connected them. So we have in total 100 girls who got jobs. But again, in the refugee camp, we still have a big number of girls. They are trained, but they don't have jobs. And as the vision groups, we provide what we can afford, because when it comes to startup capital, we cannot manage. We feel like we want to support them to start up something in their different zones, because in Chakatu refugee settlement, it's having 9 zones, and those 9 zones, we have 21 cells. It's a very big villages with many number of refugees, and mostly are young people and mostly affected by child marriage. So we saw that we want them to start up, to have a startup capital, but by now we don't have it. So we keep on training others, and those have trains who have skills. They can be with their skills. Others, they have started in the refugee community, but others, they don't have support to start up something to work on. So when I come to the boys, yes, the Vision Group is a youth and women organization. We have boys in our group. When you come to the One Touch Studio, we are promoting talents in music, dance, and drama, and mostly refugee boys. They are in that area. They have talents in music, in dance, but as the One Touch Studio, it is in place to promote their talents and to use those talents to raise awareness in the community, and also connecting them to different networks. Like we have the Uganda Youth Adolescent Forum, which working on sexual and reproductive health for young people. It's a national organization at the national level, but I get connected with them, and they supported us to that area, engaging boys and girls, reaching in schools outreach, community outreaches, raising awareness on ending child marriage, because boys and men are the perpetrators, and they're the one taking out these girls to marry when they're still young. So all of them, we engage them, and I started a fish pond also for men and boys who are to end violence, who are advocating ending violence in a refugee community. So they are in that, they're doing that fish pond and training other more boys to do the same work for as a kind of like income in the refugee community, whereby men, they don't have jobs, and which we saw that it brings a lot of domestic violence in homes, and also to push them to marry off their girls when they're still underage. So we're trying to create networks and also creating small groups, whereby if there is any opportunity, those groups, we support them with documentation, how they can write a call for proposal with a small fund, start up small businesses. We provide what we have here. Thank you so much.
That is incredible work. Thank you so much. We could have a whole other session on approaches to engaging men and boys and other gatekeepers in this work, but we'll save that conversation. I want to thank everybody for joining us. I really want to thank our speakers. This project was really through the generosity of the government of Denmark. So Andreas, thank you for that work. Thank you for coming and sharing your reflections. Frida, Dr. Nate, it's a pleasure to have you be able to share some of your insights, your perspectives from this work in your communities and in your networks. It's incredibly important, and we really hope to see it continue to grow and be replicated. For those of you who are in the audience, please check out the resources around this project. We have the research brief, as well as a number of targeted issue briefs that talk about the various aspects of what the research revealed, as well as some of the approaches to developing the roadmap and forward action. So you can find that at www.womensrefugeecommission.org. And in our resource library, we have all of that resource all of those resources under a hub. But really, thank you everyone for joining. Happy International Women's Day, and looking forward to continuing this conversation going forward. Thank you.